Before we go into the heart blocks, I always like to review the heart blocks by drawing it out on the board because nurses notoriously confuse the heart blocks. So I want you to notice a few things about how I drew this diagram here on the board. So I have a happy face and an angry face. And I have, so half of the board, 2 of the blocks are happy, 2 of the blocks are angry. Here in the middle, 2 of the intervals are constant, 2 of the intervals are changing. So on the heart blocks, everything that you need to know about the heart blocks is directly related to their PR interval. So here is a first-degree AV block. This is a second-degree AV block, type 1. It's also called Mobitz 1, also called Wenckebach. Over on this side is a second-degree AV block, type 2, or a Mobitz 2. And this is third-degree or complete heart block. Okay? So, first-degree AV block is not a rhythm. Of all of the blocks, this one has the asterisk because it is not a rhythm. You have a first-degree AV block with a sinus rhythm. So the PR intervals, okay, so if you imagine PRI, PRI, and PRI, the PRI on the first-degree block is constant. So every time you measure the PR interval, it is constant. Now what's unique about the first-degree block, what that means, a normal PRI is 0.12 to 0.20. So for this one, it's long. So every time the PR interval occurs, it must be longer than 0.20. So if this one is 0.24, this one must be 0.24, 0.24. So when you have a first-degree block, all that means is the time it takes to travel from the SA node down to the AV node is a little longer. So what usually happens is this is either a very well-conditioned, fit individual who doesn't need to move that impulse very quickly through the conduction system, or you have a person with an aging conduction system. So this is actually called a sinus rhythm with a first-degree AV block. So that is the one. The other 3 are rhythms themselves. So they're not a sinus rhythm with them. You have a second-degree type 1, second-degree type 2, third-degree. So it is a happy rhythm. So the first degree is a happy rhythm because it's never going to worsen. It's never going to turn into a higher degree block. Same as with the second-degree type 1, also called Mobitz 1 and also called Wenckebach. So this PR interval changes. So when you measure it, and I'm just going to make a number up, let's say it's 0.16. Now I always tell the story when I'm in the class that I went to nursing school in Connecticut, and I never heard the Wenckebach song when I was in nursing school. So probably some of you are out there laughing, but longer drop, now I got my Wenckebach. I never knew that until I was actually teaching this course for about a year, and someone told me that, so I share that with you. I'll explain it after the video if you don't know it. So the PR interval changes. Think of the Wenckebach song. It lengthens. So if it's 0.16, this next one is going to lengthen. Maybe it's a 0.20. And then maybe this one is a 0.24. So it lengthens until it actually drops a beat. When it resets, it typically will reset to right where it was before, and then it will progressively lengthen. The reason this is a good block is because you can anticipate when you're going to drop the beat. So it gets longer, and what happens is it goes past the refractory period that it's too late for the ventricle to fire. So that's why it resets again. So in addition to calling it a second-degree AV block type 1, you normally should include as part of the rhythm interpretation the number of P waves. So on this one, now it still can be variable. I have 4 P waves to 3 ventricular beats, or 3 QRSs. So it's a Mobitz 1, 4 to 3 conduction. So this is the complete interpretation of the rhythm. So these are the good rhythms. A second degree type 1 is not going to worsen to a second degree type 2. But this is the bad side. So the rules on the PR interval are still exactly the same. But you'll notice there's something very different with this. So I look here, I have PQRST, PP, PQRST, PQRST, PQRST. Well, what the heck happens here? Whenever you have a rhythm strip where you have more P's than QRSs, you have to suspect you have a block. So, knowing my PR interval is constant, if I measure this PR interval and it's 0.16, every time the P wave conducts through the normal conduction system and it produces a QRS and a T wave, what will the PR interval be? It will remain constant at a 0.16. So the problem with this rhythm is where the block is occurring. So this PR interval, 0.16, 0.16. So why is this a bad rhythm? Oh, you only dropped 2 beats, you said. But if you've ever seen a patient who's critically ill with a second degree type 2, and I forgot to write Mobitz 2 here, a second degree type 2 can actually look like this. And I'm going to be showing you some strips in class where you see this. And I've actually seen a patient on one of the units where I work at the hospital that they had about 11 P waves between their R to R waves. So if you can imagine, maybe their atrial rate is firing at around 88, but that ventricle is firing at about a rate of 10 or 11 beats per minute. So you can see, if you consider the same information, the PR interval on this strip, let's say it's 0.20, this one here will be 0.20. But this is the problem with the second degree type 2. So second degree type 2 or Mobitz 2. The final rhythm that I'll talk about on the block, so it's a bad block, and a second degree type 2 can worsen to a complete heart block, and this one again has a changing PR interval. So what I did here, I actually drew it as if it's a mathematical equation. And let's imagine this is a 6-second mini strip here. So here's my atrial beats. 1, 2, 3, 4, 5, 6, 7, 8. So my atria is firing at a rate of 80 using a 6-second strip method. My ventricle is firing at a rate of 30. So you almost have to break the rhythms apart as I did here, because what you will see on the rhythm strip is this. Actually, let me redraw this without that in, so you can see better. So you can see so when you look at a complete heart block, sometimes it's very, very difficult to see the waveforms, okay? So what you have to do first is find what you know are 2 P waves, okay? And this one kind of just didn't bring down evenly. So if you would measure this PR interval, and then measure this PR interval, and this PR interval, what the nurses sometimes say is, oh, it's getting longer. It's a Wenckebach. It's a second degree type 1. But what happens is the waveforms combine the P waves and the QRS, and it actually changes the morphology of the waveform. Where I said the PR interval was here, actually you'll see the beginning of a start of a P wave here, and this T wave, or this QRS, does not look the same. This is another one here. So you would put your calipers on and measure them, and you would end up finding that the P waves are very regular.